I am Panjavi Siddha, Dr. Natarajan speaking. Today we will see how to control renal failure, ultimately how to cure it. Renal failure is one of the side effects of diabetes. The blood sugar control is not achieved. If it is prolonged and unhealthy foods are taken, it will lead to renal failure. In renal failure, the function of nephrons in the cells in the kidneys, they fail. Then it increases the urea, blood urea and serum creatine levels. Once they increase, they will cause the edema of the lower limbs and feet. That is called pedal edema. And then if it increase abnormally, it may lead to pulmonary edema. The water will lock in inside the lungs. Then patient will feel the difficulty in breathing. At that stage, they have to go for dialysis. Why in diabetic patients the renal failure is caused? That is, in diabetes, microvascular circulation, that is a circulation in the small vessels, arteries in the body becomes affected because gradually the micro vessels will shrink. And then the cholesterol also plays an important role in diabetes. When the blood circulation becomes less and less in the kidneys, they will lead to renal failure. The cells will die, nephrons will die, the number of nephrons will come down. Compared with hepatic failure, that is liver failure, if even 10% of liver cells are functioning, we can improve it. The liver cells, they will regenerate and we can improve it up to 100%. But in kidneys, the nephrons, once they die, they will not be regenerated. So with the available nephrons, we have to manage renal failure. That is a problem. If the nephrons are totally lost, there is no other go except renal transplant and dialysis. So, how to prevent this situation in diabetic patients? First thing, they have to control the food habits. They have to control they should not take sweets, then fruits, and then they should not take the oily masala foods and non-vegetarian foods. Milk and curd, they have to reduce or they have to avoid. Like that, the diet they have to follow. Natural diet they can take, and then they have to keep the blood sugar level under control at any circumstance. Then only renal failure can be treated. Then, how we treat renal failure? In my practice, I treat the renal failure with Panjavi medicines. That is Amira Sanjeevi, human Panjavi give. Then there is one kidney herbal powder, K powder. That is very helpful in reducing blood urea and serum creatine. And then they increase renal secretion, improves the function, they remove the edema, pedal edema. And then we give antioxidant Sanjeevi tablets 1 and 2. They will remove the toxins in the body and they will increase the renal function. So they are also very helpful. Then we use this KSC oil, that is Karura Sanjeevi oil, Karura Sanjeevi Thailam. It is a Varma oil. The name of Karur, the Siddha of Karur. This oil is produced by my friend Dr. Mohan Raj of Karur. He has studied Siddha medicines. He is an expert in Siddha medicine and he have learned the Varma Shastra for all Varmas for 4.5 years in Takkalai in Kanyakumari. His Asan is now more than 90 years age. He has taught him all the aspects of Varma. That oil is Varma oil. Is very, very, very useful. We use it to put 5 drops inside the umbilicus and then 15 drops around the umbilicus, and then clockwise you have to massage it for 108 times before going to bed in the night. Once you do it, it will cool the organs inside the abdomen, inside the body, even brain, and then it improves the function of the internal organs: liver, spleen, pancreas, kidneys, bladder, prostate, heart, lungs, brain, everything. So during daytime we work, we think, we worry, we do all the things which hit the body. This oil cools down the entire body and brings them to rest. So this oil induces sleep immediately. It will give sound sleep, sleep without dreams. That is possible only in yoga, meditation, but this oil does the same thing. So this we recommend for all patients. By using all these things and keeping their diet, that is reducing the salt intake and then avoiding sugar, fruits and oily masala items, bakery food and everything you have to avoid. Then milk, curd and non-vegetarian foods, they have to be totally avoided. You have to avoid it. So then only the blood, urea and creatinine will come down. Once it's come down, we can keep it at that level and we can prolong our life for any length of time. That is my experience. You can use our medicines and keep your kidneys healthy, and you can come out of renal failure. I wish you all the best to use our medicines and regain health. Thank you.